fertility treatments work? Doctors say they found a way to answer that question before starting therapy. It's an easy test that predicts fertility success.
I had wonderful embryos, finally, really good ones, but still it didn't result in a pregnancy.
3 unsuccessful in vitro fertilization attempts, and Martina Zimborski was losing hope.
I just want to know why.
So she decided to undergo a new test.
An endometrial function test is designed to try to find patients who may have abnormalities in the lining of the uterus that may keep them from getting pregnant.
When an embryo enters the uterine cavity, it tries to invade the tissue on the uterine wall to make a connection, allowing access to the mother's blood supply and nourishment. But the body needs certain molecules to make the wall of the uterus ready to welcome the embryo. Without those molecules, the embryo can't attach itself and thrive.
There are people that make the molecules that they're supposed to, but they don't make them at the appropriate times. And then there are those that don't make them at all.
Armed with that information, doctors can add hormones, or in Martina's case, have her add some weight to normalize her hormone levels, a move that will likely translate into fertility success.
We may be able to modify something about their cycles in order to bring them into sync so that window of implantation is there when it's supposed to be.
Melinda Donahue hopes it's that easy. She's had 3 unsuccessful inseminations.
It's hard because you're waiting those 2 weeks after the process, and then you find out you're not pregnant, and then you have to start it over again, and the cost, too.
This time, Melinda's leaving nothing to chance. She'll have her uterus tested before embarking on another round of fertility treatment.
This is a test that we can do in the office without anesthesia. We basically take a little plastic catheter and we place it through the cervix into the uterus, and we basically aspirate a small piece of the uterine lining tissue.
We want to know what's wrong because everything else is fine. That's the only thing that's stopping us. So hopefully once he figures out what's wrong, then we can treat the problem and then move on. I don't want to give up yet.
If doctors find women don't make the molecules at all, at this time there's no way to help the body create them, so fertility treatments will likely be unsuccessful. At that point, doctors urge couples to try other means like a surrogate mother, but they can tell them early, sparing them time, money, and lots of pain and anxiety.
Britney Spears.